Good evening. Good evening to you this evening as we present another COVID press conference to address your concerns and answer your questions. This evening, we have members of the media who will be with us, who have joined us for the press conference, and our principal guests are Colonel the Honorable Jeffrey Bostic, Minister of Health and Wellness, and Dr. Anton Bess, who is a public health specialist within the Ministry of Health and Wellness. This evening, we are going to deal with a number of issues which have been raised by the public and give you factual answers to those questions so that you can be fully apprised of the status. I indicated last evening in my first day that we would be having a new formats, and that the press conferences would be held on Tuesdays, Thursdays, and Saturdays. So we did a briefing yesterday. Today's a full press conference, as will be Thursday and Saturday. In addition to set days, unless, of course, something major breaks, in which case we will have a press conference, in addition to a new format for the press conferences, we are going to change slightly and use templates to make it easier for you to monitor the information and so that you could do comparisons for yourself. Therefore, there will be a template for the numbers that we give you. The full template will be ready next week, but this week and this evening, we are going to attempt to give the breakdown in the number of cases in the way that the public has indicated they prefer. I turn first, therefore, to Minister Bostic, and I should let you know, you may be curious to know that I am still in quarantine in the corridor of my hotel room, and that the background that you're seeing is actually a sunset at Harrison Point. Minister Bostic, good evening to you and welcome. Welcome, Dr. Bess. Good to have you both. Minister Bostic, I'm going to start the questions with you, please. Are you online and ready?
Good evening, listeners. Good evening, Ambassador Thompson. I am online and ready.
Good. Like a good soldier and a good minister. Thank you. All right. So the first question that we have today, which the public has been asking, which we want you to address, is the issue of the backlog. This has been a sore point for many travelers, both non-national and national. And can you update us, please, on the issue of the backlog? And then I have a number of other questions for you before we go to media questions.
Certainly. The issue of the backlog is one that we've been trying to address over the last few days. And I can say that I have definitely given a lot of time within the last couple of days, and I know I've been missing from some of the press briefings because I felt it was very, very important for me to try to manage this process and to try to lead the team in terms of getting ourselves out of the rut that we found ourselves. The backlog is still with us, and I can tell you that we are working definitely on dealing with it, but it is not one that is go away with the snap of a finger. What we've been doing at the lab is trying to stay current, as we indicated yesterday and the day before, in terms of getting results back in accordance with the categories and the time frames that were established. But we've also been operating on a parallel track or concurrently to clear the backlog so that for each shift that is on duty at the lab during the 24-hour period, there are persons who are assigned to clearing the backlog, and there are persons who are assigned to deal with the current samples in the lab so that we can fulfill that obligation. We have made some progress. I can't say to you that it's as much as we want to be doing at this time, but I give the assurance that it is a work in progress. We are working on it 24 hours, and every time we run samples in the lab, some of the samples are from the backlog and others are from current samples. So that is what I can say where the backlog of samples are concerned, but we've been working around the clock to deal with this matter.
Thank you, Minister Bostic. I really want to turn, you haven't given us any numbers, but I'm going to turn to the question of the new tests. Can you indicate, please, while you have been dealing with the backlog 24/7, as you have indicated, every day people are flying into Barbados or being picked up for one reason or another, or coming in volunteering to be tested. Can you please indicate what is happening with people who, for instance, would have been tested yesterday or today? Will they then be just thrown into the queue? Are you able to keep current? Because you indicated that you are doing some backlogs, some current. What is happening with the current people?
Right. So what we have introduced is a system where the categories would have been indicated before, and we have issued the polyclinics and testing sites with some color coding bars so that the samples that are coming from those sites would clearly indicate whether it's a category 1, 2, 3, or 4. Of course, we know that category 1s have been allocated to the Best dos Santos testing site as well as the Brantford Tate Polyclinic. And then when those samples are collected, when those samples arrive at the lab, we have the SHAPE app, which is fully functional, and we've tested it throughout the entire system so that the results are being sent real-time through SHAPE to the lab, and they're arriving in time for the lab to be able to process the samples. We have a system in place at the lab where the samples are properly sorted, and these samples are stored in a room that is only for same-day samples. In that room, we have a machine that's dedicated to doing the testing for those samples, as well as an extraction, a new machine that we should be using from today in that very room to be able to deal with those samples. And then we will follow the others in terms of the timeline for the delivery of results. I can say to you that yesterday, for example, the lab would have received about 908 samples, and those samples are well on the way to meeting the time requirements in terms of the categories, and we intend to keep this level of currency going as we indicated, because we have the things in place to be able to achieve this.
Thank you very much, Minister. I'm going to turn then to Dr. Anton Best, and the next round of questions is for him. And I will probably come back to you and then open the floor to the press. Dr. Best? Yes, thank you. I wasn't too sure if you could hear me. Is your microphone on? Because I'm not hearing you.
Yeah, the microphone is on.
Okay, I just heard you. Thanks. Good evening. Welcome. All right. So my question to you is, the public has been very concerned, and rightly so, about the issue of community spread. Do we have it? How bad is it? And we hear a lot of expressions that are used in different ways. Some people seem not to be clear. Some people are saying you aren't being clear. When I say you, the Ministry of Health and Wellness is not being clear. So I want to ask you, please, to explain to us so that non-doctors like me and everybody else listening tonight can understand exactly what the terms you are using mean. What is a cluster? We've heard that there are clusters. What is a cluster? What is community spread? When I say community spread and the average person says it, we mean that we friends got it. We know somebody who knows somebody who got it or got to be tested for it. What is community spread? It's moving around amongst agents. We call that community spread. What is local transmission? What is a super spreader? So I know that last night, one of my questions when I came back, you weren't quite ready for the comeback. So I'm asking you to explain these expressions for me. Cluster, community spread, local transmission, super spreader. And then I'm going to come back with one.
Thank you very much for the question. So the World Health Organization has categories for describing a COVID epidemic in a particular country or jurisdiction or community. So there are four categories for the description of COVID-19. And those categories are: one, no cases, and that's self-explanatory. Two, sporadic cases. And sporadic cases refers to a small number of cases, one or more, that may be imported or detected locally. So understand that with the origin of COVID-19 being Wuhan, China, it had to be exported, so to speak, where persons with the disease would have left China, Wuhan, China, and went to other places. So when a person who has COVID comes into a country, that's considered an imported case, and that is how the disease is spread from one country to another or from one city to another. When we talk about clusters of cases, clusters refer to cases that are linked to each other, either in time, geographical location, or by common exposure. It also refers to larger outbreaks of local transmission, including big numbers of cases not linked to transmission chains or multiple unrelated events. Now, the final and fourth category of describing a COVID epidemic is community transmission or community spread. And this is not the same thing as local transmission. So I would have explained to you, when you get an imported case, then local transmission happens after your cases start being imported, so to speak, and you have transmission in a particular geographical area from one person to another. What we do many times is, unfortunately, confuse or conflate the two terms, community spread or community transmission, with local transmission. So we need to stop that. So local transmission is not the same thing as community transmission. You also asked the question about super spreader. There's no set scientific or precise definition for the term super spreader.
Please, so that
Sure.
there's some elaboration for the public. Give me an example of what you mean by community spread. Don't just give me the technical definition. I live in Bush Hall. My cousin went to a party. She now has to be tested. Her boyfriend, who visits and sleeps there at our house at night, he has to be tested. Is there community spread? Does that mean there's community spread when we start passing it to others in our community? So give me an example of community spread, give me an example of local transmission, and give me an example of sporadic cases. Because if we have concrete examples rather than technical definitions, that will help people to better understand. And then I'm going to ask you then to go to the super spreader definition, please. We really want the public to be clear, because we all do want to understand, and we don't want to think that, you know, y'all are hiding behind these technical definitions that, and the average person is speaking the expression to mean one thing, and you're using it to mean something else, or to.
Absolutely. So thanks for the opportunity to explain a little further. So when we talk about local transmission, we're talking about one case to another in Barbados. So when you've detected a case and you can explain that case being exposed to another person, that is local transmission. When we talk about community transmission, it means that you have multiple cases where you cannot explain how this person got COVID-19, right? There's no set number. The definition, according to World Health Organization, is a large number. So in the example that you gave, that was not community spread. That was local transmission from one person to another, and they're all linked to each other. And those also make up what we would call sporadic cases. And when you're linking all of these cases, they're all part of a cluster. I hope that was clear.
Okay, so based on what you are saying, we have local transmission. Is that what you're saying?
What we are,
Local transmission?
right.
And sporadic cases? Is that what we have?
So what we have in Barbados is we had a large outbreak almost 2 weeks ago. The contact tracing is going to be able to tell us where these cases came from and linking them to each other. So I would have also mentioned in the press briefing of yesterday how many clusters we have, and that contact tracing is continuing the vast majority of persons that we have diagnosed in the last 2 weeks, approximately, are attributed to clusters. So I think we have about 120 persons right now that we cannot say are definitively linked to any of those larger clusters. So we have smaller clusters. When we have exhausted all of our investigations and we cannot explain why this particular person in St. James or this particular person in St. Lucie has COVID, and we have large numbers like that, that is when we can say Barbados has community spread or community transmission. But at this current point, we cannot say that because the contact tracing is continuing.
Thank you. I think that makes it a little more clear, but I'll leave the media to do the further interrogation and drilling down to get the information that they and the public might want. I believe that you were just about to define for us what a super spreader is.
Yeah, so a super spreader is usually identified in retrospect, and it's important to appreciate that there's no scientific definition or public health definition of the term super spreader. It's relatively new. So in fact, in researching this particular point, I've actually heard it being described as art because it's not considered scientific term. So the label super spreader therefore means different things to different people, to different populations. So you would have heard the term super spreader being associated with one of the clusters, in particular the bus call cluster, and that's a fair definition. However, like I said, because there's no set definition, many people are going to use that term very differently and apply the term differently to different circumstances.
So my question is, why is it that the bus crawl is being, almost it appears to people, singled out and identified as a super spreader, but the clusters are just being called clusters and are not being identified as super spreaders?
So appreciate that the bus crawl was a single event. It occurred on one particular day. When we talked about the other clusters, we talked about the West Coast clusters. I would have also previously explained that those clusters were associated with different places, whether it was Paradise Beach or bars and restaurants along the West Coast and over different days. So those were not described as super spreader events only because they were not discrete events like the bus crawl was. The bus crawl was one event involving a large number of people, and from that we have an outbreak of cases attributed to the bus crawl.
Thank you very much, Dr. Best. I'm going to come back then to Minister Bostic because I think we need then to hear from you, Minister. Can you tell us, based on knowledge within the Ministry of Health and Wellness, how many clusters we have, the number of clusters? How many people are associated with each of these clusters? And my third question would be, how many people are associated with any infection or spread from the bus crawl? So those are three clear questions, and I will pause my own questions there, and then once you're finished, I will open the microphones up to the press so that they can have an opportunity to get as much clarity as they wish on these issues.
Thank you for your questions. As we would have been saying all along, this is an evolving situation. So I can say that at this point in time, we have determined that we have the outbreak at Dodds. There's a West Coast cluster, a South Coast cluster, the bus crawl, and there is a small cluster which coming out of today's contact tracing, the preliminary report, which I will also report on, but that is also linked to the West Coast cluster. Let's deal with the West Coast cluster. There are 86 positive cases that we have identified from this cluster, 86. And there are 2 persons who have been associated with 25 of these positive cases. 2 persons associated with 25 of these positive cases. Included in the West Coast cluster, we have a West Coast bar with 27 positives. There was the Paradise Beach line, which now has 18 positive cases. 2 West Coast restaurants, I don't think those numbers have changed from yesterday, 11 and 5 respectively. The Catamaran cruise now has 7 positive cases. The West Coast Hotel 1 and 2 have not changed, 6 and 5 respectively. And then there are other businesses associated with this particular cluster that still, according to our investigations, account for about 33 positive persons. Recently, as on my way here, a report came in that suggested to me that there is a church in the north of the country that has 3 positive cases, and through the contact tracing process today, all 3 cases have been linked to this West Coast cluster. The bus crawl cluster remains at 16 positive persons, and the South Coast cluster remains at 4 positive persons. In terms of the outbreak of the prisons, there are some additional numbers that we have to add here, but I cannot say definitively because, again, this is information I received on the way here and I have not been able to verify the information. And I just want to say that I believe in sharing information. I usually do with the nation and with the press, but I like to be sure as to what I am sharing. And because in the past, we've been having results being produced or delivered once a day. And so when we give figures, that was it for the day. But the lab is operating 24/7, and we are producing results continuously. So the results have to be validated. It's not a simple process. It is a painstaking effort that is required. And that is why sometimes we may have delays in giving those information, but those are the clusters that we are dealing with at the moment. I also want to...
How many people are in the Dodds cluster up to yesterday, and was the Dodds cluster linked to the bus crawl? Because if you're saying 16 people were positive from the bus crawl, that doesn't sound like a super spreader to me. Unless you're linking Dodds to the bus crawl.
Yes, we've done that. We said that earlier. I mean, we've been saying that from day one. That the contact tracing clearly indicated that there was a link between the Dodds cluster and the bus crawl. That is a definite
What was the
thing.
number for Dodds, please?
For Dodds, would have been
Because I just said
59 staff that would have tested positive, and I believe these figures, for the most part, would have been given by Dr. Best. That included 58, 37 males, 21 females. There were 3 pending positive staff. 170 male inmates were positive, and there were 64 pending positive inmates. And I believe that the 64 pending positive inmates, those are part of what I am trying to assess and confirm so that we can report accurately to the nation.
Okay, so what I'm understanding then is that the bus crawl is being called a super spreader because it had a number of people that then affected the numbers in the prison. They resulted in the prison numbers.
From the initial press,
Was my understanding correct?
from the initial press conference related to this entire matter, this surge, I would have indicated that the bus crawl would have been a super spreader event. And it's because that event we were able to link to what has happened in the prison in terms of the contact and by contact tracing. That would have been shared with the country earlier during our press conferences. And we would have also indicated that we've been able to do some linkages with these clusters. And as a result of those linkages, then the West Coast cluster became a cluster of importance to us. But there's a linkage within these clusters.
Okay, so the bus crawl would have yielded over 200 cases then, roughly, over 200, without adding the numbers. I'm going to ask you then, Minister, if you could please give us the current numbers, because we haven't yet given today's numbers. So I'm going to ask you to give us the current numbers, and then I imagine that those at Elara Court who are coordinating the media will then start to organize the microphones of the various media personnel. I don't know if the habit is that they raise their hand in the Zoom chat. But please, Minister, if you would be kind enough to update us on the numbers, please, with some breakdown as to male, female, travelers, non-national travelers, national travelers.
I will give you the numbers as I have them, because further analysis is still being done, and those details would not have been passed on to me as yet. But so far, the numbers that I have, there are 974 test results were produced, and out of the 974, there were 84 positives, including 75 males and 9 females. Of the 84 positives, 67 are from Her Majesty's Prison, and the remainder are really a combination of locals as well as visitors, but I am not able at this stage to go any further with those because I do not have the information. I can say I believe because, as I said, there's still some work to be done here, but the pending results that would have been indicated yesterday, I believe that most of those at the prison would have been confirmed today as positive cases, and we would have said pending positive yesterday. And let me just explain this a little. When you have positive cases, especially within the scenario that we're dealing with, we then have to take those numbers and verify them, go through them name by name, number by number, to ensure and separate positive cases that would have been retests of persons who are already in isolation as distinct from new positive cases. And that is something that has to be done before we are able to say definitively what it is we have, and that is why we would normally determine that those persons are pending until we have a degree of certainty as to exactly what we're dealing with. I just want to say here that I know that when people hear large numbers, especially in Barbados, when we are not accustomed to having large numbers, people probably say, well, lost, to use Barbadian parlance. And I must tell you that I had my well lost moment too. But that moment happened when, in the space of 2 days, we had 200 and something cases. And I too said, well, lost. But then I came to grips with the situation, and I no longer say that, because we must understand that as long, having started with 200 cases or so in 2 days, with contact tracing and doing the work that is required, there will be cases, and I am not going to sit here and fool you. We will have cases. But this has to happen as long as we are doing the contact tracing and as long as we are doing what is required in order to contain the situation. What is important here is where the cases are emanating from. For the most part, we are linking the cases, and it's, like I said, it's a painstaking effort that has to be undertaken by contact tracing. And once we are linking these cases, once we are containing these various clusters, then we know that we are on the right track. But of course, numbers are numbers, and the high numbers will still be a cause for concern for people. But that is the reality of what we're dealing with at this time.
Thank you very much, Minister. Members of the media, my guests are available to take your questions. I understand that present today are Starcom, CBC, The Nation newspaper, and Barbados Today.
Hi, good afternoon, Mrs. Thompson. Good afternoon, Minister. This is Barry Aline from the Nation newspaper.
Good afternoon, sir.
I have two questions in the interim. So one is for the Minister of Health and the other is for Dr. Best. So what I would appreciate is if I could ask both of them their questions, their answer, and then the other members can ask their questions.
That's fine. Go ahead.
Minister Bostic, good evening.
Good evening. Yes, good evening.
Yes, good evening, Minister. I want to ask you one particular question, and it's related to the numbers you just revealed to us with the 84 positives coming out of the inmate population at Her Majesty's Prison Dodds. When the numbers were initially given to us yesterday, it was indicated there was one female infected with COVID-19 and over 120 males. If these numbers today are correct, that would put the numbers of persons at Her Majesty's Prison at Dodds at over 200 males and about 10 females. And based on the numbers that were provided yesterday, it was originally said that about 22% of the male population has COVID. Based on the numbers you just provided us, that would take the male population infected with COVID at Dodds to pass 25%, which is a quarter, which is 1 every 4 inmates. Is the ministry at this time willing to say it considers there's a national crisis with regard to COVID at the prison, and how the ministry go forward dealing with this?
It's part of what you were saying towards the end. If you could repeat the last sentence or so.
I was asking you if at this stage government is willing to accept that there's a national crisis at Her Majesty's Prison at Dodds with relation to the percentage of infection of inmates, and what, if anything, government can do to mitigate that situation in the short term and in the long term.
Well, thank you for your question. As far as I'm concerned, Barry, we are dealing with a national crisis. I don't think we can get away from that. The numbers would certainly suggest, and the surge, that it is a national crisis. But I want to give the assurance it's a national crisis that we are still able to manage. The capacity at Her Majesty's Prison Dodds for isolation, at the moment, we still have capacity at the prison. I can say also that we've been doing some work at the prison in order to make sure that we isolate those persons from the remainder of the prison, and that is in progress. We have people there who are working with the authorities at the prison to ensure that we manage that process. We provided a public health officer who is there, and there are also persons from the Queen Elizabeth Hospital Isolation Facility that go daily and take care of these persons. It's a matter of managing the persons who are in isolation and giving them the best level of care that we can give them. But this is a situation that will have to be dealt with over time through the normal caregiving that has been done throughout the pandemic at Harrison Point Isolation Facility, at Blackman Gollop on the occasions that we've used Blackman Gollop, and the team that is working with those inmates, those patients, a very experienced team, and I am sure we don't have a lot of people who are sick, so it is not really critical in terms of the condition of the inmates, but it is a critical situation because we are dealing with large numbers. It's a prison, and that's why we've added additional resources there from other institutions and entities to make sure that we have everything going at the prison as best as we can at this time.
And a quick follow-up, Minister, to that. Now that you've said that, I interviewed the Minister of Home Affairs on Sunday, and he was satisfied that the stand-up facility, the temporary medical facility at the prison, was holding. But now we have 84 more males and 9 more females having tested positive. Are you still satisfied that that facility has the capacity to deal with a continuous positive infection rate?
Remember, what I would not have been able to give you, for example, because as I said, I do not have all of the information available to me because this is a very fluid situation. But there are persons who will be due for discharge, even from isolation at Her Majesty's Prison. If you check the dates and so on that people have been in there and the way this thing goes, you will recognize that over the next few days that there will be inmates at the prison that will be discharged from isolation. So that is how it is going to be managed in one sense, in that people may come in, people go out of isolation. That is what happens at all isolation facilities. But in addition to that, there is still capacity within the prison facility for isolation, and even the upgraded medical facility at the prison, which is not part of this isolation center itself, that still has a lot of capacity because we are not dealing with a large number of sick persons.
Okay, thank you. And my second question is for Dr. Best. You can hear me, Dr. Best?
What was our question?
Right. My question is based on some information that would have come out yesterday. We would require an update in terms of numbers as much as you're in a position to do so. We want to know in the last 24 hours, how many persons would have been released from quarantine having received a second negative result. We were told yesterday there were over 400 visitors to the island, but there was no real breakdown with regard to how many would have been released. But can you tell us how many have been released in the last 24 hours? How many of them are Barbadians that were awaiting second tests? And how many of them were visitors that were awaiting second tests? And how have the numbers played out in the last 24, 48 hours? If you've had 50 left, how many have you had come in that now have to wait for secondary negative results?
Yeah. Barry, let me thank you very much for the question. And let me explain that we would have talked a lot about our systems being very challenged. And one of the systems that have been challenged in the last few weeks is the system of data collection and the information. So all of the questions that you've just asked is very important information for us to determine how effective our strategies have been, our interventions have been. But our systems are not yet mature enough to give us that information in a real-time manner. You may have recalled that yesterday I was very hesitant in responding to some very specific questions about the numbers. And the reason is that we are now implementing those systems to be able to capture those data, to give us real-time information that is accurate. So I don't have those numbers to give you at this particular point in time. The other...
The best, however, I mean, can you give us a round number about how many people are still awaiting second test? Is it over 200? Is it less than 400?
I am not doing that because that would be me guessing. I would really much prefer to give you precise figures. We have I would have talked about the SHAPE app that we have. When we are fully utilizing that app, we would be able to tell you all of that information. But right now, we're not in a position to provide that type of information.
And my second question, Dr. Best, is directly related to some information we've received. Over time, we get a lot of information in the media, and we're not in a position to confirm it. But these are questions that, as our Ambassador Thompson mentioned, people want to know. It's come to our understanding that we have some young people who are COVID-19 positive in Barbados. And I was wondering if you could give us an idea of the age of the youngest person in isolation. We also understand that we have a pregnant mother in isolation. If you can confirm such, could you tell us what is their condition? And it would be good to tell us just if we have critically ill persons in Barbados, how seriously ill are they? Are they intubated? Are any critically ill? Can you give us that kind of information at this stage with regard to persons in isolation at Harrison's Point?
Right. So, Barry, you may recall that Dr. Corey Ford, who is the head of the isolation facilities, gave that information yesterday. He didn't go into details about the young persons that you're asking about. He also didn't go into details about pregnant women. but give him the opportunity to talk about that, because that's not information that I have at hand.
Okay, thank you. Is Dr. Ford going to be with us at any stage today?
Not to the best of my knowledge, no.
Thank you.
I apologize. He's going to be with us on Thursday. I'm still trying to determine what are the needs of the media as the situation goes along, so that we can work out who we should have on a continuous basis and who should not. Perhaps we may need to have Dr. Ford at all the press conferences. He is going to be with us on Thursday if the program that I'm planning for Thursday, if we're able to put that in place. So he should be here on Thursday, but I'm going to plan in the future to have him at all the press conferences if it's possible.
Hi, good evening, Ambassador and Minister Boston and Dr. Best. Randy Bennett from Barbados today here. Just two questions. The first one, either Mr. Boston or Dr. Best can answer. There have been some suggestions that we have the situation under control as relates to the COVID-19 testing and the cases, but there's also been a fluctuation in the number of positive cases that have been coming back. Does government still feel that it has the situation under control? We had 84 positive cases come back today. Yesterday we had 5 or 6. How does government feel about this trend?
Well, once you say government, then I'm sure that I have to take this one. There is absolutely no way that as Minister of Health and Wellness that I would sit here and say to you and say to the people of Barbados that this is a situation that is completely under control. In relation, for example, to the testing and the return of results, we admitted that we've been struggling with that and that we have been taking steps, and I'm very hopeful because of the steps that we've taken and what I'm seeing happening now, that we are going to get out of this in the coming days. But that has been a struggle. So that to say that we are completely in control of everything that we're doing, what I can say to you is that the situation at the moment, we're trying to contain the situation. We're doing everything possible. It is not out of control, but to say that it is under control would be to say that we have everything at our disposal that is going the way that we want it to go. And when I say that it is not out of control, I mean because the cases that we are seeing predominantly are linked to the clusters that we have identified. And until we see, and I hope we never see a lot of cases across the country that we are unable to link, then we know that we have not lost control. We have not lost control because we still have the capacity to deal with what we are dealing with, even though in 1 or 2 areas, which we would have mentioned, that capacity has been stretched but not broken. Broken, but can be fixed, and we are fixing those areas. So I'm saying to you that we are very much managing the situation. There's no need for alarm at all or panic, but we are not going to rest until we are absolutely satisfied that we have it fully under control. And when we have it fully under control is when the numbers are going to be on the decline in the way that we anticipate.
Next question. There were some reports of some positive cases at the psychiatric hospital. Could you give me an update on that?
Further update at this point.
I cannot give you an update. What I can say to you is that, yes, this thing has touched a number of areas and a number of institutions within the country, and the psychiatric hospital is one. We have people that we have tested using the protocols that we use for everyone else, but we don't have all of those results. I know they were being processed today, but I cannot say at this stage where we are with it. But we are not seeing anything within the hospital itself at this point in time that we would be worried about. But like several other institutions, there are persons who have been connected to other persons with some of these clusters that have tested positive.
Thank you.
You're welcome, sir.
I have a quick question for Dr. Bess, since no one seems to be asking one at this time. Dr. Bess, there has been a lot of rhetoric going around that persons who are not au fait with public health or the way public health is facilitated are understanding. And there's a question that has been asked by the media before, but is not yet really been answered in the way that the media would want it to be answered. And that question is with regard to index cases and investigations of clusters that could possibly lead to the nexus of all clusters being linked. Now, government has said there are 4 clusters. What I want to find out is the Ministry of Health actively investigating the index case of individual clusters? In other words, if you have 4 clusters, is the Ministry of Health seeking to find 4 index cases that could be considered the link to each cluster? That is something that I think we need some information on that we've yet to receive from public health officials.
Yeah. So Barry, at every press conference, we talk about the clusters, we talk about the progress where contact tracing is concerned, and I personally make it a point to re-emphasize the importance of contact tracing and to explain to people that this is an investigative process that takes a lot of time. When we identify what you're referring to as the index case, the case is closed. We have actually explained and mapped out the entire cluster. So we have not done that as yet. We've even had questions about who patient 0 is, and we may never find out who patient 0 is, but we are working towards making links to all of these cases by identifying them to persons within existing clusters that are very clearly defined at this point. So like I said, give us time. Every single day we're learning a bit more and a bit more. We're linking people to clusters. We're able to define additional clusters. Like I said, and like I asked before, just give us more time to be able to fully map out what is happening and who is part of this outbreak and how their cases can be explained and infection attributed.
Best, there's a level of trepidation within the society that index cases for any of these 4 clusters may not be found. Is it highly probable that you could continue this contact tracing and not find these 4 index cases?
I don't want to say it's highly probable. I would just say it is possible. It is entirely possible that we can exhaust all of our efforts and we do not know what started this particular cluster. We would have talked about the bus crawl cluster linked to the prison cluster. We would have talked about the multiple clusters along the West Coast. We know they're linked. We can't even say definitively which one started first. Okay? But like I said, give us time. The vast majority of persons in this outbreak we have assigned to a cluster because we made a link, whether it was that they were in contact with a particular person at a particular venue, but we're still working on it to try to identify the other persons in terms of linking them to clusters.
Are we any closer to having the capacity to test for the new variant?
We don't have the capacity in-house in Barbados, but certainly within the next few days, we should have submitted, well, I actually don't know if it took place yesterday. We were supposed to submit the samples to check for the new variant. I can't tell you when we will get the answer about the new variant, but certainly the new variant is something that we have identified as a possibility to explain why we had such a large outbreak almost 2 weeks ago.
And the tests that we are sending to be tested, have they been chosen randomly or based on the symptoms of the patients?
I don't have those details.
Dr. Best, I think
Dr. Best.
there's a question that emerges from Mr. Alleyne's questions, which would be how important is it to find the index case. How important is that? One, two, how complex a process is this? And three, how vigorous is our contact tracing? Are you satisfied that our contact tracing is doing what it should be doing?
So it is extremely important that we exhaust all possibilities when we're investigating cases, simply because it will tell us what category of epidemic we're dealing with. So at the beginning of the tonight's presentation, we would have talked about the difference between local transmission and community spread. We cannot say in Barbados that we have community spread because we're still investigating. But if we exhausted all possibility and then we have large numbers of people that we cannot say are linked to each other, then unfortunately, then Barbados would have met community transmission. You asked a question in terms of, are we doing all that we can? We are doing all that we can. It will still take time to exhaust the process of contact tracing. You asked another question in there. Could you repeat it?
Yes, thanks. I was trying to find out how complex a process this is. The contact tracing, the identifying the index case, etc.
It's an extremely complex process. In some cases, we have people that would come forward to the healthcare system and say that they were in contact with a particular person and they're now experiencing symptoms. When that person is then identified with COVID, we can then say definitively that these two persons are linked and then probably part of a larger cluster. But to be able to identify people and assign them to clusters, it depends on the capacity of the healthcare system. It also depends on the honesty of the persons that you're investigating. So we do have scenarios in which persons do not want to reveal all of the information, and if they don't reveal the information to the investigators, we are not going to be able to say, well, this person is part of this cluster if they're hiding something from us. So for instance, if somebody went on the bus crawl, but for whatever reason did not say, yes, I was on the bus crawl, which everybody's talking about, then we're going to have a person that we have a question mark over. So how did this person get COVID? So it requires cooperation, and that's why we have talked to the media multiple times about the process. We've asked people to be cooperative and assist us in the Ministry of Health, those of us on the ground who are doing this type of investigation, to be as frank and as honest as possible, because it is helping us to contain further spread of COVID-19 in Barbados.
Because I would not want at all for viewers to go away with the view that contact tracing is really all about finding an index case. Contact tracing is not only about, in fact, that is part of it. I don't want us to be not going after the shadow and miss the bone. Contact tracing is the meat of what we are doing right now. We have to contain the spread. And the only way we can contain the spread is to get to all of those primary contacts through contact tracing so that we can test, quarantine, and who test positive, isolate. And that's why the numbers will go up, because by doing that, we are containing the spread. If we do not do that, if we got the index case and we don't do the contact tracing with the primary contacts in order to stop the spread, we will not win this battle. And that is why it is important for me to make that point, because the contact tracing is vitally important to what we are doing now, and the teams are out there doing a fantastic job to find all of those primary contacts. I can tell you up to yesterday, because like I said, we have not had figures in from the field yet for today, but there were about 253 primary contacts that we have been investigating. And this is really germane to the effort to contain the situation so that we can get back to some degree of normalcy that we enjoyed for 9 or 10 months, where we were doing very well until we reached this obstacle. But it's an obstacle that we can overcome.
Thanks, Minister. I think
Minister
CBC
Bostic. Yes, Minister Bostic, Ryan Broom here from CBC. I just want to I don't want to say driving the nail here or anything like that, but I'm just for clarity, or Dr. Best can speak to this one. Is it possible, based on what we're saying, that we could have multiple patient zeros, multiple indexes? And I'm basically trying to say, I asked the question, let me put it in a more layman way. If 3 or so persons or people associated with each of these clusters, separate and individual, we have one in the South Coast, we have one in the West Coast, we had one at Paradise Beach, where one individual that was carrying in each case could have caused these clusters to start, as opposed to actually them being linked or looking for a link that may not exist. Is my question clear?
Yeah, I think I understand your question. It is an interesting question, and that is why I emphasize we are not necessarily looking for a link, in my view. Through contact tracing, we are taken to a link. So it's not a figment of our imagination. It's the scientific process through investigation that we find out from, let's say, a primary contact, who are the persons that you would have interacted with over a period of time. Then we go and we investigate those persons. And then when you do that call it detective work if you like, then it takes you in a particular direction. You don't lead yourself into that direction. And we've already established that there are linkages. Even the last one that I mentioned today, which is the 3 persons from the church in the north, they have already been linked through contact tracing to the West Coast. And we have linked. The only thing that I would say, based on, except for some that obviously are still under investigations, so we have to see what happens there, but we have not been able to link the index case that would have triggered what we are seeing. But that is not the most important thing right now. The most important thing right now is for us to focus on dealing with what is before us, what we can see and what we know. And we know that we have to work hard with the primary contacts and follow this right through to the end in order to contain the virus, the spread of the virus.
I have a question for Dr. Best. I'm hoping he might be able to answer. Dr. Best, based on the numbers that the minister just mentioned with regard to the prison and 84 new cases, there's a question I really need to ask. If the incubation period of COVID-19 is as scientifically proven to be around 14 days, and the first cases in this crisis would have been recognized post December 26th, how is it that we are still getting new cases within the prison? The reason I ask that is, if persons who were either inmates, civilian staff, or warders had been identified as being COVID-19 positive and were isolated from inmates, how then are we getting new infections of inmates within the prison if all those who previously tested would have been isolated from the general population within a 14-day span?
Ari, I could always trust you to ask the most difficult questions, and then some of the questions that I'm not in a position to answer, but I can answer this one. You started off by saying that the incubation period is 14 days. The average incubation period is around 5 days, right? However, we give a range of 1 to 14 days, because in some cases you will get outliers to as long as 14 days. And the 14 days is also important because it's the quarantine period that we apply because of the incubation period if you're not doing testing, okay? So let me just start off by making that very clear. What you are essentially asking is, how is it that we're still identifying new cases at this particular point? We are identifying new cases because the persons were recently exposed or have been exposed within that 14 days, right? So we're not out of the woods as yet. We're simply not out of the woods as yet. And we, from the beginning of this outbreak, we expected more inmates to become positive. We expected to detect more prison officers who are positive. What you try to do when you identify the cases is to keep them isolated from other persons who are negative. But what you're seeing is a result of these persons previously being exposed. So I hope I'm clear on that. We're still within that period of possible exposure.
And I would like to add to Barry that you would recall that we would have tested the entire population at the prison for the first test, and then a second test was done. The first test would have picked up numbers, and the second test has also picked up numbers. So
are we to assume, Mr. Then, that these new 84 cases were identified upon second test? Can you confirm that?
I cannot confirm that right now because you will recall when I started giving this information, I said that I just had the raw information, but I didn't want to keep it till tomorrow because I didn't want the impression to be given that we were hiding anything, so I gave what I had. But if you want me to come back to you on another occasion with those kind of details, I'll be happy to do so.
That would be appreciated. Minister, just one quick question. The Prime Minister would have made reference the last time she spoke to the country about vaccinations and that we were expecting, at least 4 vaccinations in the first instance, and she was hoping that Dr. Ford, yourself, and Dr. Singh, and maybe her, might be the first to be vaccinated. Can you update the country on what's the position?
If I could
vaccinations?
intervene, please, Barry, thanks. We are going to do vaccinations as a subject on Thursday. So I'm letting the press know that now, and you can bring all your vaccination questions then so that we can deal with it, because we're going to deal with that very comprehensively, because I know a lot of people are afraid of the vaccine. There's a lot of information out there. People are quite nervous, and we have to deal with vaccinations as a separate subject. So I think Kat King just turned her camera on and she hasn't asked any questions yet. I'm not too sure which media house she is with, but we do want to give her an opportunity, and we'll deal with the vaccinations on Thursday. Thanks for your understanding, Barry. Ms. King? I don't think your microphone is on. I can't hear you. Are those at a lower court hearing, Ms. King? Because I'm not hearing anything.
No.
No, we can't hear you. Ms. King, no?
No, not hearing.
So are there any other questions? Ms. King, if you post your question in the chat, please. If we can't hear you, post the question in the chat. We're prepared to put it to whomever you wish to answer it.
I have another question for
Yes,
Minister Bostic. Yesterday, Ambassador Thompson revealed that government had given QEH $3 million, which would go towards the payment of hazard pay. But Ambassador Thompson only mentioned doctors, as I recall. I was wondering, there's been some concern that it seems as if only doctors are the only frontline workers receiving this hazard pay. I would need some clarification on that. And just one more question. Could I have an update on the Randall Phillips Polyclinic? I know it was closed. Could you give us any information on when that will be reopened and the position there?
Let me deal with the hazard pay. And unfortunately, I really did not listen to the press conference yesterday, only because I was really busy in the lab helping to get things right in the lab. But this thing about hazard pay, the Ministry of Health have been paying hazard pay since March. The Queen Elizabeth Hospital had to go through a process in terms to get where they're, and this process was approved, funding was approved, but the funding was not approved for doctors. This is for every category of worker within the hospital situation, including all those at the isolation facilities, from manager to janitor. It is for all persons. There's no class or anything like that. A hazard is a hazard, and a hazard don't care if you're a doctor, lawyer, teacher, or anything. So that all persons who meet the criteria for hazard pay at the Queen Elizabeth Hospital will be given that hazard pay. I can give that assurance because I know.
Bostic, Sorry, Ronnie, go ahead.
Sorry, he didn't answer the second question. Just an update on the Randall Phillips Polyclinic.
To be honest with you, I wish I could give you the update, but today I was focusing on the COVID matters, and I really cannot say. I'm not even sure. I don't know if Dr. Best can shed any light on that. I will find out and I can get back to you if you wish me to do so.
Okay, thanks.
Minister Bostic, I know you were just referring to being at the lab. What I'm trying to find out is if, with the pressure that is on the lab in terms of the test results for COVID, what's happening with
your audio? I'm not hearing you.
Sorry, right.
Yes.
I said, right. We obviously know that there's pressure on the lab in terms of the COVID testing. What's happening in terms of the non-COVID testing? Is there any pressure on the people? Obviously, people are looking for test results for other things that are not related to COVID. Is that causing any pressure in terms of the test results for people who are seeking results for other things?
Right. What I can say to you is that the entire lab staff at Best Dos Santos has not been utilized to deal with COVID because, as you correctly stated, there are other things that have to be addressed. And there are other things that are still going on in the lab other than COVID. What I can say perhaps is that those tests that require the use of a PCR machine, then that may be an issue in terms of the speed of delivery and so on. But outside of those tests, then all of the other things, the staff, there are other lab techs that are dealing with those other matters in the lab.
Ms. King has posted her question, and it is for Dr. Best. Let me just indicate that the hazard allowance ranged from consultants to doctors to registered nurses to nursing assistants to paramedical and technical staff to ancillary staff to EMTs. And there were categories of payments for each, all negotiated and agreed with the unions, I believe, and all carefully laid out. But the complaints we were hearing, and that's why we dealt with it in that way yesterday, was that, you know, doctors were on the front line and were not being treated fairly, were not being paid. But the hazard allowance goes to a range of categories of employees, starting with consultants and embracing everybody, including EMTs, ancillary staff, paramedicals, technicals, nursing assistants, registered nurses, doctors, and there are categories of payments. There's a daily amount for each category. So I just want to make that clear. Ms. King's question to Dr. Best, and we are cutting into news time. So if we could, I'd like for us to finish in the next 10 minutes or so, please. Apologies to CBC. Katrina King of Loop News Barbados is asking of Dr. Best, have you had any situations where a person who has been tested a second time is only now receiving their first test result and is a positive? Is this possibly one of the dangers of the backlog in receiving test results? I will read it again for the benefit of the public, but I know that it's on your screen. Have you had any situations where a person who has been tested a second time is only now receiving their first test result and it is a positive? Is this possibly one of the dangers of the backlog in receiving test results?
Yeah, that is a very good question. It is one of the dangers and something that we are bracing ourselves for because we do not know, we don't have all of the answers. And when we start to clear the backlog even more, we're going to get answers to a lot of these questions. Right now, I don't have that information to say definitively we've had X amount of persons being diagnosed on the second test when their first test was outstanding due to the backlog. But certainly something that is theoretically possible. And that's one of the reasons, if I may add, that's one of the reasons that we have started a system just 2 days ago where we were prioritizing samples, and we prioritized samples in the backlog that were primary contacts. I believe Minister Bostic would have mentioned that number earlier. We identified just over 250 persons whose samples we deemed to be urgent, because these were persons who were exposed to index cases or exposed to persons who had COVID. So we're particularly interested in those persons, and we want to tease those out of the backlog and be able to get a result on those persons.
Dr. Best, question. Does the World Health Organization have a recommendation as it relates to a timeline within which an index case should be found after confirmation of local transmission? And if so, has Barbados exceeded that timeline?
WHO and CDC, none of the authorities have any timeline or criteria that we need to meet in that regard.
Thank you.
Glad though that the line is still very much alive as long as we have contact tracers or contact tracing to do.
I want to thank you. I don't see any other. Okay, and Ms. King is asking a follow-up question, which is, Dr. Best, again for you, which West Coast cluster is linked to the St. Lucie Church?
I don't think that we have the answer to that. We just know at this particular point that one of the West Coast clusters or one of the cases on the West Coast are linked to the church cluster that was recently identified.
I'm not seeing any other questions, and as I indicated, we are cutting into news time. It's 7:13. I therefore propose to thank all of the members of the media for joining us today. I want to thank my guests, Minister Bostic and Dr. Best, for their cooperation and forthrightness, indicating both what is being accomplished and what we are failing to do. So let's do a synopsis. So far, the contact tracing has been extremely vigorous and is taking the medical professionals where they need to go in getting on top of this. There continues to be a backlog, but new systems have been put in place to cut that backlog down, and every day it is getting shorter. Meanwhile, a new system has been put in place to ensure that we keep current. Members of the public are cooperating largely, but the ministry is urging people to come forward and not to hide information. We have explained, we know now the difference in the expressions being used: cluster, super spreader, community spread, and local transmission. We have to absorb all of this information and come to grips with how we have been using this language in ourselves.
Well, I think I'll take the opportunity, since we seem to have a connectivity issue, to really thank each and every one of you for listening, and the press for the very good questions that you've asked us. I hope that we've been able to provide you with as much as information as you desired. And for those questions that we promised that we'll get back to you with the answers, I will endeavor to do so. So thank you, Barbados. We are all in this together. We need your cooperation and your support. And I am sure this is not the time to retreat or surrender. It's not no retreat, no surrender, only when things are good. This is time to dig deep, and we are going to work to get this matter resolved. Thank you all.